Hi, I'm JoAnne Reifsnyder, Chief Nursing Officer for Genesis. We know that long-term care has been particularly hard hit with COVID. I don't think any of us could have imagined what the last 9 months were actually going to be. Our residents in particular have suffered so much from their isolation, from separation with their families, and our staff have suffered as well from illness themselves, from COVID, and from the strain of trying to care for our residents and their families during this really difficult time. We know that regardless of how careful we are with infection prevention measures, community prevalence, what's happening around us outside of the center, is a factor in the incidence of COVID inside of nursing homes. I am so relieved that we have a vaccine on the horizon. Vaccines have changed public health over the past many decades. Vaccines are safe and effective ways of stopping the spread of significant illnesses like COVID. I have great faith, and I'll be standing in line as soon as I am able to receive a vaccine. I hope that you will feel the same way, and we look forward to making this important move and getting farther down the road in terms of stopping this pandemic.
Hi, I'm Rich Feifer. I'm Chief Medical Officer at Genesis. We are so optimistic that COVID vaccine approval will be coming as soon as this week and next week, and that will bring the final phase of the pandemic to us, the beginning of the end of this very, very challenging time that we've all experienced. We don't know all the details yet about vaccine distribution, but we're going to keep you informed along the way as we learn and as we figure it all out with federal, state, and other authorities. What we do know is that the scientific process leading to this point has been sound. It's been robust. It's been one of the most intense research efforts ever underway in healthcare. And in record time, we have multiple vaccines with very large numbers of people in the studies, and the scientific process has been strong. I'm confident that the scientific process is working. I'm looking forward to receiving the vaccine myself. I hope you will consider it as well. As we see all the final data come out from the pharmaceutical manufacturers, from the CDC, from the FDA, we will be reviewing it carefully, and we'll share it with you. We'll share with you data on the effectiveness, data on the side effects, which, by the way, indicate that our immune systems are actually working. So mild side effects after receiving the vaccine, they instill confidence in me that our bodies are reacting appropriately and developing immunity. But I know that you'll have questions. We'll all have questions along the way. We'll do our best to answer them. We'll do our best to be honest and transparent. And then together, we'll figure out how we're going to get this done. And we look forward to getting through the rest of the pandemic and closing this door with you. So thank you very much, and we'll talk to you again soon.